My name is Wendy Valencia, and I'll be presenting my nutrition support case study. I will be presenting on a 72-year-old male. He has small cell lung cancer with metastasis to the esophagus, herpes esophagitis and candida esophagitis, dysphagia, COPD, GERD, and hearing loss, which is just something you want to keep in mind when speaking to the patient. And his surgical history includes a G-tube placement, which is placed the same day as admission. A majority of cancer patients will develop malnutrition. Patients who present with weight loss have been shown to have an overall decreased survival rate, showing a need for increased nutrient needs to maintain weight. And my patient has had a significant amount of weight loss. And looking at this picture over here that I included about lung cancer does have the lowest five-year survival rate among all common cancers. Treatment is resection, chemotherapy, radiation, or a combination of all three treatments. Dysphagia is universal in patients with cancer in their esophagus. My patient has lung cancer, however, it has metastasized to the esophagus. Enteral nutrition via G-tube or J-tube is an effective method of nutritional support in these patients. And the standard MNT is increased nutrient needs because of weight loss and malnutrition, and tube feedings, which is indicated because of the dysphagia. So I assessed my patient on day 2. He was admitted to the hospital after PEG placement for pain control, and the consult I received was a tube feed initiation. So he is 5'10" and weighs 175 pounds, but the important thing to look at is his weight change. He's had 16.6% weight loss over the past 2 months, and this is mainly due because of his low appetite, and he's had difficulty swallowing from dysphagia. And then looking at his labs, they're all within normal limits, except chloride and albumin is a little low, and then his calcium is high. So his diet order is NPO, and he has higher needs due to his cancer diagnosis and weight loss. So I based his calories off of 30 to 35 kcals per kilo, and then his protein needs 1.2 to 1.5 grams per kilo, and his fluid needs 30 to 35 milliliters per kilo. And I recommended Gevity 1.5 at 70 milliliters per hour, and here we can see what that would provide. So Aspen does recommend that immune-enhancing formulas that contain arginine, glutamine, omega-3 fatty acids, and polyribonucleotides may be beneficial for malnourished cancer patients. However, I do not have this formula available at my hospital, so I chose Gevity, which is a standard polymeric formula that is calorically dense because of his higher nutrient needs, and it also contains fiber. So my PES statement, difficulty swallowing related to dysphagia as evidenced by decreased intake, NPO status, and PEG placement. And my recommendations is Gevity 1.5 at 70 milliliters per hour for the next 24 hours, and 200 milliliter water flushes every 4 hours to meet his fluid needs. And then increase the tube feeding by 10 milliliters per hour every 4 hours until his goal rate is reached. So on day 3, my patient had high residuals. He was tolerating lower volume feeds at 20 milliliters per hour. However, when the nurse attempted to increase his tube feeding rate, he complained of abdominal pain and distension. His residuals were checked and they were greater than 400 milliliters. So I spoke to the doctor and we discussed trickle feeds for the day because he has not been able to tolerate anything over that, and to do this until a GI can assess the patient. So the doctor also did consult GI regarding this complication. So his current order was Gevity 1.5 at 70, but the new intervention was to trickle feed Gevity 1.5 at 20 milliliters per hour for the next 24 hours. And then right here we can see how much that provides. So on day 4, GI did come and visit the patient, and the gastric emptying study was performed, which indicated severe gastroparesis. So he did have a PEG, but now it was going to be converted to a GJ tube because of that. And he was NPO for the day. So day 5, there's now a new order needed for the GJ tube. His current order was NPO, and his intervention was going to be Gevity 1.5 at 70, and it would remain the same because this rate was meeting his needs. So on day 6, I did check on him, and he was tolerating his tube feeding. So day 7 was his discharge day. His tube feeding was running at goal rate. The patient stated that he is tolerating tube feeds well without abdominal pain or distension. And per RN, the residuals were 10 to 20 milliliters. So here we can see a summary of the labs. They all essentially stayed about the same. His albumin did go up a little bit. The main one that I did look at was his glucose was a little elevated and started rising more when his tube feeding did reach goal rate. So it's just something to keep in mind and keep an eye on. And then here's a summary of his stay at the hospital. His PEG was placed on day 1. On day 2, I had my initial assessment done, and I ordered Gevity 1.5 at 70. On day 3, he had high residuals and GI was consulted, and we trickle fed him that day. On day 4, his G2 was converted to a GJ tube because of his severe gastroparesis. On day 5, his tube feeding was increased to goal rate, Gevity 1.5 at 70. And then on day 7, he was tolerating tube feeds and discharging home with home health. And then here are my references, and thank you.